Good afternoon. This is Dr. Bill White again, and I'm going to talk some about surgical cases again. We're going to try to put a whole series of these surgical cases up so you can look at it. Whether you're interested in doing that or not just depends on you and how far you get along with your orthodontics. It is done today, and we figured out ways to avoid some of it. And this is not a real severe case. It's a Class 3 case, and I honestly think I could do this one by a 6-year molar, lower 6-year molar extraction case. But anyway, the people wanted to do this, and this was back in I think number in 88 when this was done. So anyway, I'm going to go through with it. It won't take us too long. We'll show you some things about surgery and what you have to do if you do decide that you want to do surgery. This is a very attractive young lady, and she's got this Class 3 problem. It's not severe, but it's there. And from the side view, it's hardly noticeable. She's got a little prominence of the chin, but when she opens her mouth, you can see she's Class 3. Now, she may not be quite this bad if you open it, just see how far you can push the lower jaw back or get it back. You probably get these teeth right underneath the upper centrals, but it's still Class 3. And you can see where this molar is setting in here way out further than it should be. It should be back in here somewhere, like that. So anyway, we got a Class 3, and they decided they wanted to do the very fanciest stuff they could here, so they're doing the surgery on it. Now on the left side of the mouth, it's Class 3 too. Over here, this tooth right here just broke off the model. I don't know exactly where it went up there, but anyway, it is a Class 3, and they decided they wanted to do surgery, so I contacted the surgeon, and the surgeon will tell you what he wants you to do, and if you can do it, that's what he is interested in. And so here we'll go with the case. You can look at this. I just jumped past one there. The cuspids are rotated where the crossbite jumps over in there. And down on the bottom, they broke the model, the tooth off the model of the left cuspid over there, and this is 8 of 1988, and we'll look at the situation. Like, I've talked with the surgeon, and the surgeon looked at the case and decided what he wanted me to do, and he wanted me to coordinate the arches. In other words, even though you can't put the arches together, he wanted me to make the lower arch fit underneath the upper arch. So you have to take impressions and pour up not any fancy models or anything, just see exactly what you got to do, and you've got to reduce one arch somewhere and increase it somewhere else, and everything to get it to where the upper arch fits over the lower arch, not in the mouth, but just you make them where they will fit when the surgeon moves the jaw to that position. That's what I'm trying to say. We want to have the jaws fit together when he does the surgery back here. He's going to reduce the jaws back here, and he'll take the maxilla loose and all this. It's a big lot of surgery to do this. Okay, so we'll go on from there now. This is well, let me go back. Now that's 1990, January of 1990 is when he told me to do that, so we did that. We coordinated the arches, and I sent her back to the surgeon after we got them coordinated and everything. In other words, it's a pre-surgical orthodontics, and then the surgeon takes charge of it and takes care of them for several weeks in there, and then they come back to you for post-surgical orthodontics. In other words, he'll get the jaws fitting over one another and as good as he can surgically, and then you've got to finish them out orthodontically after he does the surgery. So it's pre-surgical orthodontics, and then there's surgery, and then post-surgical. All right, here it is. He takes the case back here in January of 90. Now, this is all ready to go. And so I'm going to show you the case after he did the surgery. Okay, here is 7/16 of 90, and the surgery is done. You can get some indication up here. You look at the gingival tissue in the lower jaw, and I'll show you more of that when we look at the x-rays and everything. So this is 7 of 90, and I'm going to try to get this jump to another case over here. That's the way it looked when I got it back from the surgery. And it looks pretty good, but it's certainly not finished out properly. And we'll do some more correction. I hope we rotate that tooth there. It sure needs some rotation on it. All right, let's go through it. Now, this is the way the facial structure looks though now. You see the chin is back. It was kind of out, but the chin is back now. It looks quite good. Now let's see from the front. It looks good too. Everything's lined. There she is. She's got braces on the teeth, but we're going to go in now and try to do the finished orthodontics. Now this is the way it looked when we got it back from the surgeon. You see, it looked kind of like that. And we got some poor pictures in here, but anyway, that's what we picked up with to do after we got through. Now there's where it was to start with, and whoops, I mashed it too hard. And there's where it was to start with, and there's where we picked up the case and got back starting on it again. And now there's where it was, and there it is in 1991. There's where it was to start, and this thing is jumping too far. Okay, and there's where it is there. This is 1988, that's where we started with, and there it is in 1991. Now here we're showing either 2 or 3 cephalometric pictures, and this is the starting cephalometric back in 1988, and you can see it is a legitimate Class 3 case. The chin's out some, the maxilla's not developed quite like it should be, and so they're going to down graft it a little bit. Now here it is after the surgery. You can see where they screwed the jaws together back here. Now, and here they tied the maxilla back in place, and we had to torque these teeth way out here to get it over and everything. And we'll see the teeth, though they look like they're laying down there, but the teeth really have a good angle to them when you look at them. Okay, now this is the, I think there's 3 or 4 panorexes. This is the one we started with. Now this young lady had wisdom teeth back in here, and the upper wisdom teeth were up so high they didn't have any push on these teeth. And that may have been one of the causes for this Class 3 case, you see. The position of the upper wisdom teeth. I'll erase that so you can look at them. And honest to God, I do think if I were looking at this case today, I would think we could take out these 6-year molars and slide this tooth up part of the way and bring these back the rest of the way and slip this tooth in underneath the second bicuspid right here, bring this wisdom tooth underneath that, and we would ignore these up here, else have them taken out or something. Anyway, I'm just saying I think that I could do this with your lower 6-year molar extraction cases, but this is water under the bridge. That happened a good many years ago. And the best I remember, they really wanted to get this young lady looking as good as she possibly could. And we'll see what happens now. Here is the the Panorex. The surgeon wanted the wisdom teeth removed, you see. Now he's going to do his jaw section back in this area back here, so he lets it heal up a little bit, so it takes some time to do that. Now you'll see the Panorex after we did the surgery, and you see where you slice that, and then you shorten the jaw, and then you screw the two plates together right here. Now up above they tied the maxilla back, and that stays in there. It's in there. You know, it has those screws and those wires holding things together there. And now let's look at a little further down the line. Here she is finished, and I think in these pictures we've done the post-surgical orthodontics. We went back and finished it up as close as we could. And here is her smile. And let's see the teeth. Now the teeth look ideal. I mean, and you can't see the surgery much. You get a little bit of a scar up in there, but not much. And this is the finished stuff. And it came out great. And to my knowledge, the case held up good. And we have a Class 3 retention. We can put them in if we needed to. We made retainers for, of course, to stay with that. And that's the way her teeth looked. And you saw the way her face looked back in that other, and you can back it up and look at it. And we did rotate that tooth. I think that's the one I was looking at. Yes, we rotated them and got them in there, and everything looks great. And so this is to me, a pretty simple Class 3 case that you do surgery on. And this was done an awful lot back when they had the insurance would cover them. Now they've got to be pretty bad off to get the insurance to cover them, because it's the expensive procedure to do this. So I'm going to hush, and I appreciate you listening to this. And I'm going to do several surgical cases and kind of put them all together. And if you're interested in surgery and orthodontics, you can go study all of them, and you'll learn a lot of things about them. So I'm going to say goodbye. Thank you for watching them, and we appreciate you joining our little group here. Thank you now. Goodbye.